Aloha, everyone, and thank you for joining the COVID-19 Public Health Action Webinar, Pursuing Equity and Lessons Learned in 2021. My name is Makamai Namahoy, and I'm with the Hawaii Public Health Institute. Before we get started, there is some Zoom housekeeping to go over. Next slide, please. For all questions, please utilize the chat box or the question and answers box located at the bottom of your screen. No continuing education credits will be provided during this webinar series, and all webinars will be available on the Hawaii Public Health Training Hui's YouTube channel. Before we get started, I would like to introduce to you our presenters for today. Our first speaker up is Dr. Ka'ohimanu Dang Akiona, who is a Native Hawaiian community-based family physician and researcher. As a part of the Premier Medical Group Hawaii, an independent medical practice founded by Dr. Scott Moskowitz, she leads community outreach and clinical operations, which include mobile health services and a street medicine program focusing on primary care and COVID. Her team has used innovative approaches to address disparities in and barriers to access and delivery of healthcare. Her professional interests also include health equity advocacy, cultural competency, and patient-centered integrative health models. Our second guest speaker is Kat Brady, who is a community justice and advocate coordinator of Community Alliance on Prisons. CAP is a community initiative promoting smart justice policies in Hawaii for more than 2 decades. CAP's work includes the conditions of confinement, visitation issues, racial injustice, and cultural and human rights concerns. CAT also serves as a prisoner representative on the UH Institutional Review Board, is a board member of Kale Maile Ali'i, and works closely with several community organizations to promote justice and equity issues. Our final speaker is Na'alehu Anthony, who is a Native Hawaiian storyteller from Ka'awa, Oahu. Na'alehu's approach to culturally grounded storytelling shapes strategies for projects and campaigns to improve the well-being of communities locally and globally. As director of the Hawaii COVID Collaborative, a hui of private businesses and nonprofit organizations, Anthony oversees COVID PAL, which is a statewide education and communications project working to support Hawaii's people through the COVID-19 pandemic by removing barriers in access to good information, resourcing effective outreach strategies, and advocating for policies that meaningfully advances our community's recovery. Anthony co-founded OEV TV, the first Hawaiian language and cultural focused television network. His production company, Paliku Films, helps give the voice to Hawaii's stories through documentaries and oral histories. So I'd like to hand it over to Dr. Akiona.
Hello. I'm going to share my screen and I'm going to try and go through my presentation pretty quickly. Is that all right?
Yes, that's great. Thank you.
Okay. Okay, so I go zoom. Sorry. Okay, so it is not. Okay, pardon me. Can you see? Are you able to see the first slide?
No, we just see you, Doctor.
Dang it, I'm so sorry. Okay. Zoom. Do you want to skip over me?
That's okay. Yeah, so maybe we'll have Kat, you can come on first and then
Okay.
we'll have you, give some time.
Oh, here it is. Okay, I'm going to do it. Sorry.
No, all good. Let's see if it's.
And I'm going to do this one. And yeah, I just tried it again. So you tell me if it's working now. And we're going to start from the beginning. Yep.
Yep, looks good.
Right now? Okay, I apologize. Sorry about that. Okay, so on behalf of Premier Medical Group, I thank you for kind of giving me the opportunity to talk about what lessons we learned over the course of the last kind of almost 2 years now, taking care of the vulnerable. And I'm going to give you kind of my take on what we've done as a Native physician. I'm going to let you just know that our team really, we are not COVID. We didn't start off as COVID experts. We really are family medicine clinic. And we're private practice, we're a physician-led group, and we really do try to do what we know is right. And so I think the reason why it works for us is we focus on our community. We try to do things with compassion, and we really, really, really try to do things with integrity and treat everybody like their family. We actually had a pre-existing focus before COVID even started on vulnerable populations, specifically on street medicine, on Native Hawaiian and Pacific Islanders, and on other high-risk populations, those with substance abuse issues, those with mental illness. We are not a federally qualified health center or a community health center. We're a practice founded by Dr. Miskovich. You see him on the left with me. Let's go forward. Sorry. So I think if I were to summarize, and I'm going to kind of go through these quickly, and I apologize, but if I were to summarize what we did in the last 18 months that was really important, it's actually that we bridged the gap between theory and practice. And so we're family physicians, so we're very broadly trained across all ages, and we were able to kind of synthesize a lot of information, because if you guys think about the last couple of years, we've really been having to learn a lot about ourselves, about virology, about epidemiology. And so our job was really kind of to talk about in the entire continuum, kind of cover the complete care continuum from outreach to education to testing, and try to make it as understandable to as broad a population as possible. So we really were good at helping create models that address a wide variety of tiers of risk, and we could kind of apply it to different community and care settings. And so we were comfortable doing this outreach and doing these education and kind of testing support, both at the shelters, in community centers, in resort settings. We had to be kind of adaptable. Our main focus was always bringing the care to the patient, to the group, or to the community, and we really tried to tailor it to their needs. But we are mostly well known for being more nimble. We generally are self-contained, and we try to bring everything we can, as many options as possible, as we guide people through both understanding what their personal risk is and how to help address their personal risk mitigation and the professional risk mitigation. So kind of how are you existing both in the home and outside the home? And then adapting our guidance for all the different types of settings, making sure that you have a contingency plan. That's kind of what we did. If I were to break it down, we were very good at providing expert guidance nationally, at a state level, at a county level. We continuously kind of kept track of trends in Native Hawaiian health, in Pacific Islander focus. I particularly, and this is one thing that Dr. Miskovich and I were really, trying to advocate for, was the social justice part of things. And I'll kind of touch on this a little bit later why, but the COVID really focused, really emphasized a lot of the health disparities. And then in the meantime, we're kind of helping businesses, sports leagues, all different parts of our kind of normal day-to-day life exist. We always used a multi-layer approach, always looking at both risk and vulnerability in different settings from the bigger picture. So kind of maintaining that surveillance, what's going on nationally, what are things looking like, what are our safety goals, and then really keeping track of the acute needs. So how are things shifting? Where are the clusters? How are high-risk groups doing? And I think what really tied it all together was that we continued to provide regular patient care, and this really gave a good context to both that bigger picture and that smaller picture. And so again, kind of emphasizing that steady focus. And so our steady focus has always been that, the focus is always going to be the better to try and improve the health of the entire community. And we really do believe that improving the health of the most vulnerable improves the health of the entire community. And in order for this to happen, we really need to make sure that we're keeping an eye to access and equity. And so for us, the approach was always make sure that we're always shining light in every corner, that you don't leave Molokai behind. We don't forget about Hana Maui. We're always trying to look for places that we feel, maybe don't get enough attention. And then always maintaining the ability to kind of shift, so the acute shift, right? So we're always thinking about what is the active read in the pulse of the community. And so we really are community-based and focused. I chose these pictures in particular because these were actually screenings done at the shelters on Hawaii Island. And on the right, the upper picture is actually the first time we did COVID testing so we were on a homeless outreach, and those are my two nurses, and they were collecting COVID tests. This was over a year and a half ago, actually. And so we really made sure we were involved in safety net focuses, and we advocated for always kind of maintaining support for other organizations that really touch on what I call medically adjacent services, because these are the people that are going to know what's going on in the community. And so these are a list. I won't read through all of this, but essentially we try to advocate on all levels to kind of stay involved and to always ask the food basket, ask the college students, ask the general community, what's going on and what are you concerned about? And then kind of keeping that in the back of our minds while we're seeing our patients. Sorry about that, keep on. So I think what was interesting was that we would define vulnerable community kind of, in numerous different ways. And so it was important for us to understand that, the obvious vulnerable populations when we think of high risk kind of situations, and then kind of, what we would choose to focus on in the moment. So we were always kind of watching the people who maybe are a little bit marginalized by the healthcare system, but we also kind of tried to keep focus on the high risk folks. So people where we would ideally not want something bad to even start because it could potentially just get way worse. One of the things that was hard for people to understand, I think, was that when you're really defining the vulnerable community, if you really take a good look at our entire state, majority of our state actually exists in low resource areas. So that third bullet point was really, I think it's still hard for some people to wrap their minds around, that majority of us actually exist in a vulnerable situation in terms of what types of resources we have. So, we've been trying to kind of learn from other countries and other state agencies, looking for things, trends, patterns, and how do they manage resources and how can we learn and apply it, and how can we kind of share. And so I just wanted you to keep in the back of your mind that we often belong to many communities. And so when you think about what community, it's your neighborhood and, your professional community, your personal bubble, all these kind of things, we realized over the course of COVID that all of these things matter. And so I'm actually on the bottom row on the left. And so this was one of the examples that I remembered that my community is, like, I can define it so many different ways. Now, defining community is one thing, but defining vulnerable was interesting because over the course of the last 2 years, we've talked to thousands and thousands of people. And when we asked them what they thought vulnerable was, I would say the four on the left is what people were pretty comfortable, right? They're like, okay, homeless people living in rural areas, our elderly, our kupuna, people who don't have insurance. They're like, yeah, those are vulnerable. But what we see with COVID is that it's so much more complicated and that we really we owe it to the community to give real true context to it and to remember that, there's all these different levels of the vulnerability and that your risk really kind of changes when you look at it on a bigger scale and on a smaller scale, and really helping people understand that they have a lot of overlapping spheres of risk and vulnerability, and that health is not as simple as how old you are, but do you have access to healthcare? Can you afford to pay for your healthcare? And what type of structural issues are there that serve one population more than another? And these are things that we kind of knew about, but COVID really kind of emphasized it. Another, kind of helping people understand their vulnerability based on their jobs. So, people didn't realize like public works or first responders, those might be a little bit more, obvious, but social, like just being like bellhop at a hotel, that's very front facing and your vulnerability is actually higher. Even just regular lifestyle daily activities, it's so much more complicated and more layered than just, simple, the homeless people or living rural. And so, the idea that social responsibility, we all owe it to, I think this is one thing that we saw across Hawaii, is that we agree, a lot of people agree that we do need to kind of focus on our vulnerable people. And that was kind of reassuring over COVID, because we know that COVID and the pandemic has really emphasized things that we already knew was true. So we already were aware that there's some, issues with healthcare access, for example. In Hawaii, before COVID started, we actually had started doing surveys with our homeless community. And what we found out was before COVID, most of them were pretty well insured, but they really didn't have access to healthcare. And this was starting to become true in actually even the housed. We were seeing all of the weak points in the care continuum. So, continuity of care and the ability to just follow up with a primary care physician. It was pretty big. There was very clear disparities in how resources are distributed. And that, the vulnerable and marginalized population, when you really look at them and the new buzzwords of the social determinants of health, it tells a lot of the story. And so really what we saw is the trends that we observed before. So people that were kind of vulnerable marginalized before, it tended to really, really kind of over exaggerate a lot of the trends that we were already aware of. And so, very briefly, I know I'm sorry, we're going to go through this quick, but access to care. So, I mean, one of the things that came up for us again and again is that there's a difference, there's a very clear separation between the perception of our access to care at multiple levels, at leadership levels, and even at the personal level. Do we really truly have equal access to clinics and hospitals and long-term care? So if the hospital says, hey, just get an order from your PCP, come up and get the test, no big deal. How many of us can do that? That was actually an important question in March of 2020. So it was, we're still kind of struggling with the fact that the physician shortage in Hawaii County alone is among some of the worst in the nation. And so when you're really looking county to county, somebody's journey to get care and then to go through care varies huge, just in huge ways. And then on top of that, we know that there are some cultural and systemic disparities that kind of, we see that an African American going through the healthcare system versus Caucasian or versus an Asian American, we have a different experience. And so in Hawaii, Native Hawaiian and Pacific Islanders ended up carrying a disproportionate share of COVID, the burden of the disease. And so there is, we could have so much, just a long conversation just about systemic racism and bias, but there really are differences in the care that's received between ethnic and racial groups. And then there's the more, other things, geographic barriers. Our island is very big. And then all of the socioeconomic barriers that stop or hinder us from getting appropriate care. And so for us, like the stuff in green, I'm going to say are the kind of things that what we tried to kind of keep in mind, right? So we tried to remember that island by island, county by county, moku by moku, it was never one size fits all. We always had to be kind of adaptable in how we're thinking about things. One of the other huge things that we learned was really big issues in health literacy and messaging. And so really this is probably one of the biggest things, especially now with Omicron kind of popping up, misinformation and in the setting with especially with vulnerable populations, with the history of distrust. And so, we're looking at this emotional appeal and using anger as that hook to get people into information and really making people feel like an other in the kind of social construct. And then tying that to something that we want them to have an informed choice. So we want people to feel like they're getting the best information possible, but maybe they're not. And then kind of, this has been kind of the hardest part for us, is that we really do feel like the misinformation and this distrust, it kind of disproportionately affects people that are marginalized. We look at people who just assume. So like, for example, homeless people, you would actually be surprised when we explain to them the risk in the same way I would explain it to my mom or my sister. They understood why I was asking them to take the test, and majority of them completely agreed. They would submit to the test, or they would, opt for the vaccine. It really, what it came down to is giving them equal amount of effort, resources, and support. And they were able to understand what we were trying to say, as long as we didn't come in with an assumption saying they're not going to want to do this anyways, why even try? And so it was always just kind of remembering that, sometimes we're kind of struggling with this idea of privilege versus responsibility. And so we're tossing out kuleana a lot. But, the privilege of having good information and the responsibility that we have to share it with everybody equally, and making sure that we understand that when we mislead people, we downplay the danger, the risk of that, it's not borne equally across the society. So we're really, like, from our perspective, both as a Native physician and a family physician, it's really understanding that we have a responsibility to really focus on education, make sure that we persist and that we don't downplay things, because when things go wrong, it's going to be the marginalized people that end up kind of suffering more. So I like this. I like this. I think that we can resolve things as a nation if we do it together. And I'm just a Barack Obama fan. So some take home points. I think this has been the biggest thing, is that when we keep on saying we are in this together, I think it's more important for us all to personally kind of understand that what it really means, especially in Hawaii, is that we're all vulnerable. and that it's a very complex concept. It has a lot of emotional and mental weight, and that we really cannot exist in the it's not going to happen in my circle kind of situation. I try to stress for everybody after the 18 months of being in the front lines that there's both responsibility and privilege in what we know and what we share. And that we do need to acknowledge and kind of understand that there is structural bias that kind of works against different populations more than others. I still stand by that, if we can help the health of the most vulnerable, it'll improve the health of the entire state, the entire country, but that sometimes the health system itself is the barrier. I think one of the things that we've learned is that I can have a lot of clinical experience, but it was really important to marry that and really integrate it with the community expertise and make sure that we understood who we were serving, why we were serving, and how we were going to do it, because that ultimately helped with the equity part, because we needed to do this quickly. We needed to make sure everybody had access, but we needed to make sure it was equal. In a state like ours, there is no such thing as overlap. We are resource challenged, and there's a lot more risk, and there's a lot more things that we just don't want to see, which is good and bad, but we really emphasizes how connected we all are. And so I think if you take out infections from this last line, it's not really about preventing. So in COVID, right, it's not really about preventing any COVID. You can put that in there. It's about preparing and arming everybody equally, right? So you can actually put diabetes in there. You could put anything in there. And that's really why I think family medicine, coming from our training, this is why COVID kind of really emphasized our training a lot. So I try to give you guys something to what can we do? Because that's always me. I'm like, what can I do? So I think the 3 things that you can do: you can advocate, you can educate, and the last one is kind of funny. I'll talk about that. But so advocate, we really got to talk about engaging and really believing in the equity and trying to understand how a better education really leads to better health, and that it's important for accountability in all of the things that we're doing. That the intent can be very good, but if it's even more important to follow through and make sure that we're executing well. Education is huge. So you can educate yourself, help me teach others, and then, reach out to your community. And remember, your community, you have multiple different types of communities. Talk to your family, talk to your friends, talk to your circles, and really ask them to make sure that, they understand things, that they're getting their information from good places. And then I always joke around that we try to perpetuate the Miscavige model. So we dream big and we do huge things. Say yes. We believe that the care in Hawaii can get better. And I think that was why we were so successful, is because we believed it could get better. So we just did it. Keep asking questions. Look, we tried to look for other people trying to fight similar problems. And rather than saying no, we just did it. And we just try, we learn, improve, we share, because we really feel like serving the most vulnerable puts you on the right side of history. So I'll just leave this with so this is Dr. Miscavige. I'm learning a lot from him, and I appreciate he gave me the space to be the native physician kind of serving our most vulnerable one. So I really do think that if we focus on the person in front of you and you do what's right, it's gonna work out. That summarizes our last 2 years. If you have any questions, this is my email address, and thank you for letting me fly through that presentation.
Awesome. Thank you, Doctor. Really appreciate your presentation. We'll have you stick around for questions following our other 2 presenters. So I want to hand it over to Kat. Oh, Kat, you're muted.
Sorry.
No.
Aloha, everyone. I am really happy to be here today. And I am really glad that Dr. Akiona spoke about messaging and context. I think those are 2 things that we definitely need to improve. So I work with people who are incarcerated, and, Community Alliance on Prisons works as advocates. So we listen, we hear what people are saying, and then we try to develop their ideas through legislative and policy means so that their voices, which have been silenced by incarceration, are actually part of the big picture. So our goal is always to make things more just, more humane, and more equitable. So since March 2020, we've been doing a lot of research to try to figure out what is happening in confined spaces. And the one thing we learned is that there was more focus on people who were on cruise ships, or in nursing homes than people who actually live in overcrowded, dirty, and unventilated jails and prisons in Hawaii. So we, as it raged on, I started looking through, at other jurisdictions on the continent, around the world. How are they interacting with their people who are incarcerated? And what I found out was there's lots of prisons on the continent that were doing town halls where they would invite experts in, but the people inside could actually ask questions and get answers. So that was something that I was really trying to push, and that was not successful. They were not too interested in doing that. Logistically or whatever. But to me, you need to talk to people about something that is a threat to everyone. And this is, this is about everybody's health, not just people inside. It's people who work there, people who then go in and out of the prisons back to their families and communities. We want to make sure that everyone is protected. So we, the problem with Hawaii is that we waited way too long to actually pay attention to the people in prison. So what that did was, in the absence of real information and context, as Dr. Akiona was talking about, that's fertile ground for disinformation, misinformation, and other things that are damaging to the health of everybody. And that was a real problem. And it gave rise to QAnon and all these, other websites that some people were making a lot of money by scaring people. So I went to the Department of Public Safety and I asked them, I'm getting a lot of questions. Can I produce something that you would hand out? They were like, oh, well, we'll see. Give me something. So I think around June or July, we started to put together something after surfing all the CDC websites and trying to find answers to the questions that we had been receiving. And what we found was that people were really, really hungry for education. So I asked the department, what kind of education are the people inside getting? And I was told, oh, they have a robust educational system. And when I talked to people inside, they told me that amounted to signs over the sinks that said, wash your hands. That is not enough. And, the new normal became people who were fearful, the tensions in communities, in facilities rose, and management became a huge, huge problem. So it was counterproductive that they weren't actually trying to give information to people. So in the absence of information, we put together this, the straight scoops on vaccines. And we called it that so that people would know this is not a government publication. This is something that's in plain language, but it's something that you can understand that would answer your questions. So I brought the first draft over to the department, and this is the English version of it. And after it went through their process, looking to see if I was saying anything that was subversive or I was trying to kidnap people inside, they looked at it and realized that all the information came from the sources that I cited, which were CDC sites. So at that point, they said, yes, you can hand it out. And then I realized that there's we have a multicultural population in our facilities. So I asked what other languages are spoken. And I was told that they were English, Hawaiian, Chuukese, Ilocano, Samoan, Tagalog, Vietnamese, and Tongan. So I could find on the websites the English version and the Vietnamese version, but I couldn't find the other 6. So luckily, I've been a member of the Institutional Review Board at UH for 20 years or more. And I pleaded with my colleagues, can somebody help me figure out how to get these translated into different languages? Well, I gotta say, the university was amazing, and there are specific people there who were just awesome. And one is Kiriko Takahashi, who's the interim director of the Disabilities Center. And she was amazing and contacted people. So she actually facilitated, along with Pauline Chin, the Hawaiian translation, the Chuukese translation, and the Samoan and Tongan translation. And then there's this amazing woman who actually works for the Hawaii Public Health Institute, May Rose Dela Cruz, who is really active in the PhilCom Cares project that the Filipino community is doing. And she got right on it, and she hooked me up with somebody who actually translated the straight scoops into Ilocano and Tagalog. So the translations were amazing. And I think that we need to really understand that this is a community effort. This is not something that came from the government. This is something that the community generated because of the questions we had been getting and the lack of messaging and context. So I'm big on giving very clear messages, plain language messaging to people, and especially when we're in this kind of crisis. So it's really important that I felt that everybody who spoke other languages other than English would have access to the information. Like some of the questions we were getting was, is it going to mess with my DNA? What if I want to get pregnant? Is it safe? What if I am pregnant? Is it safe for me to get vaccinated? And at first I thought, oh, I would put those questions to the women's prison, but then I realized that, it really is universal. Men who are in prison actually have wives and girlfriends who have those questions. So I really wanted to make sure that I covered the things that were asked. And that's when we had it translated into Chuukese. And I am so grateful to LJ Rayfand, who actually did the translation. Thank you so much. The Hawaiian translation, had amazing. Pauline Chin pulled together a great group of people, Puakea Nogelmeyer, Alika Mauna Kea and his mom, and Kaleo Lani Akim Hanohano. They together did the Hawaiian translation, and that was really powerful. The Ilocano, May Rose contacted PhilCom Cares, and Clemen Montero did the beautiful translations in Ilocano. The Samoan translations were done by Brian Thompson and Tafa Tui Tupuola. And just I just received a beautiful letter from her. So I just think people wanted to do something. And the Tagalog was done by, Clemen Montero. She did both the Tagalog and the Ilocano. And the Tongan was done by a couple, Sisi and Isabella Halatuituai. And that was amazing. So they did this, and we were able to actually help people understand in their own language what was going on. So to me, that was one of the most crucial things. So after we had it all translated, and it took months to get all this together, we sent them to the department. They were handed out. They went to all the prisons and jails. They went to the Kawailoa Youth and Family Wellness Center. Some teachers asked in Hawaii, and I sent it to them. It went all over. It's been on lists for all across the Pacific, the United States, and around the world. So this is really, really crucial. It is a community action that addressed a real problem. And we've been receiving a lot of messages, people saying, oh, is it okay if I copy it? And we always say, of course, it's like love. It only works if you give it away. So if you'd like a copy, just email me, kat.caphi@gmail.com. I would be happy to share any or all of them with you. We're humbled and heartened by the tons of aloha that went into this. People were so excited to translate it into their language to help their specific communities. This is just aloha in action. It is really amazing. And we all want peace. And I really feel that this is just one small step on the road to peace and health equity. Thank you.
Thank you, Kat, for your mana'o and sharing with us what your work has been. Now we're going to hand it over to our last speaker, Na'alehu, to close us out.
Aloha kako, and just a huge mahalo to Dr. Akiona and Kat, as well as all the folks who put this together, Alana, Makamai, and others. Just, want to mahalo everybody for the opportunity to come and maybe just talk story a little bit with you folks today. And, I feel like the two presenters really resonated on just a handful of things that I was going to talk about as well. So I'll try to be brief to allow for some discussion towards the end of this. But I think what's really important to note is that there are some resonating pieces with respect to how we can move forward as a community. And hopefully today starts a conversation in this group about, what are some of the things that we can do as we think about moving forward, especially because COVID is not PAL. We do not have an answer for future variants, and Hawaii, just based on the way at which we have to interact with other venues, makes it especially vulnerable for this virus to move around. Maybe just really quickly, COVID PAL was born out of this idea that, not unlike what the previous speakers were talking about, but this idea that we needed to find ways to better inform subsets of our community. And so just a little over a year and a couple months ago, as part of the House Select Committee under Speaker Saiki, as well as Peter Ho's leadership, we formed a communications committee that very quickly turned into the Hawaii COVID Collaborative. And this was this idea that we needed better information as a community to be able to share with folks so that they could start to assess what they were comfortable with doing and not doing every day. And what I mean by that is like this idea of like, what is your risk quotient? We had the state or counties talking about different shutdowns and different limits of activity, but that still didn't present, we thought, enough information for people to make good decisions on a daily basis. And the two things for me that were really important, the first was storytelling. At the time, we were still getting reports where people would say, oh, there was a male who was between 60 and 69 years old who died of COVID-related symptoms. And we thought that we really needed to personalize it to be able to use storytelling as a way to engage audience, to really think about how this could be them, or this could be a family member or a loved one. And the second piece was that we needed data. And it's really interesting because the data part has actually shifted dramatically over time. And when we started off, we wanted to talk about what kind of data. So what is the rate of transmission? How many cases were there a day? It changed into hospitalizations and how many people are in the hospital. And as we've shifted over the last year, we're also talking now about what are some of the economic indicators as we struggle to balance as a community between what are the economic ways in which people can or may not be successful, and what are the healthcare ways in which people may or may not be successful, and how the two of those are buoyed sometimes in opposition to each other and sometimes in parallel with each other. And so really with that as a baseline, what I wanted to talk about was just some of the lessons that we've learned being out there in the community in different facets. You know, when we started off with COVID POW, we were really looking at what did the digital landscape look like, and how did we participate again with storytelling and with data on the digital platforms, and how did we make sure that people had access to that. And what it's turned into in the last, I would say, 6 or 7 months is something that's much more community-based and much more relationship-based with respect to who is trying to move information in and around both access to vaccines and testing, but also in and around this idea of making sure that we have the right information moving out into the community. As everyone can attest to, the ball is moving with respect to where is success. Success has shifted many, many times. In the beginning, right, we were just trying to make sure people didn't get COVID. And once the vaccine came about, we wanted to make sure that everyone who needed the vaccine, hopefully everyone in the state, could get the vaccine. And then as Delta spiked, we wanted to make sure that people had access to testing. And really what I take from that as a community member and as a consumer of this information as well, to make sure my family's safe, is that there's just a handful of things that I've either learned or would reiterate with respect to those things. And it first starts off as like showing up counts, like the idea that you need to show up in order for your mana'o or your perspective to really be included, whether you're showing up as a community member or community leader, or having the ability to bring forth resource into the community, like some of the panelists we're talking about today. That is such an important facet of what it is that needs to happen in order for there to be positive change. The second is that as people show up, we have to understand that different folks are going to bring different facets of interactivity and expertise as they come along. And what we're seeing now in the last 3 or 4 months of vaccines and pop-ups is that whether it's a auntie who's a community leader, whether it's folks from nonprofits who are volunteering, whether it's healthcare professionals who are working 6 and 7 days, it's this, whether it's social media folks who are engaging to make sure that people know where these pop-ups are. It's this really important mix of individuals who may not all be from the same community, but they can come from a similar mindset that allow us to move forward pretty much in unison, even though some of the leadership is decentralized, and that people are showing up because they believe in the work that's being done. And then, I know we only have 15 minutes left, so I'm going to be really brief here, but there's one other thing that I think is two last things that I would leave with you folks. The first is that we need to learn how to clip away at how quickly or how slowly, for that matter, bureaucracies move. The bureaucracy that is county government, the bureaucracy that is state government, only moves at a certain speed. And that is sometimes really dangerous, because actually what we've seen with the Delta variant and with other movements within state and government structures is that it moves slower than the virus is moving, right? That the way in which we can use government structure is actually too slow for what the virus can do, right? And so that means that it's more important, in my opinion, more important for some of us who are outside of government to be able to be more responsive within the structure of those who are most in need, those vulnerable communities, certainly the folks that we represent on this call. And the last piece that I would leave us with, that I think is the most important thing, is that yes, this is this terrible disease, and yes, we all wish that the pandemic had never happened, but this is also a huge opportunity to do community work moving forward. I would invite part of this conversation to take place in and around the idea that we have not seen the kind of community response when medical professionals show up in some of the pictures that Dr. Akiona shared, in some of the pictures that we see on social media with vaccine and testing pop-ups on Oahu, in rural communities, in small communities, where you're talking about something as terrible as this disease and this virus, and people will still show up to have that conversation and still want information. And typically that has not occurred before. And so what that means is that we have an opportunity, just like Dr. Akiona was saying, to insert, instead of coronavirus, insert diabetes into the conversation, insert hypertension, insert these things that maybe people didn't pay as much attention into these subsets of conversations, to allow for a more robust conversation, to really see communities become more resilient. And so with that, I'll stop and be happy to answer any questions, but just really thankful for the opportunity to present and talk story a little bit today. So mahalo nui. Aloha.
Great. Mahalo na'alehu. Mahalo to all our guest speakers for sharing your mana'o today. So we have some questions. Definitely want to ask all three of you folks. So number one, we want to take it to Dr. Akiona. As people are experiencing COVID fatigue, are there ways to better message safe practices to people who might be getting tired of hearing the same things about COVID prevention?
Yeah, no, I think probably the most important thing is just acknowledging the fatigue, because I can tell you that of all of the training that I've gone through, all of the technical stuff, really the most important thing that I could do is just look people in their eyes and just tell them I see them and I hear them, and that they're completely valid feelings. Like, I am tired, you're tired, but the fact that, I tell them this is actually a good thing. Like, you are allowed to feel tired, but you already know what you need to do. The very basic things haven't changed. You can still wash your hands, you can still wear your mask, and you can still just kind of, we've been practicing this. So it's, the very basic level, we can still, you feel almost like an expert, so I tell them, like, there's not anything technical that I'm doing different from you. I'm doing the same thing. But I think the most important thing is to just acknowledge that it is 100% acceptable to feel tired at this point. And sit in it a little bit, and just because for some people this might be the first time they had to feel this kind of discomfort, and then they can always call me and we'll talk about it.
Great, thank you. No, it's great advice. Kat, for the population that you're serving, those in the prisons, what advice do you have for folks that are on the call that may work with those populations that have community members that just have lots of distrust in government and those health officials?
Yeah, that's one of the main problems, the trust issue. I think telling the truth in clear and plain language is the way to go. And I think the problem is that our messaging was so kind of garbled at first that it made fertile ground for, disinformation. And that's, then you have a whole other thing to fight, not just the virus, but you're trying to fight the disinformation. So I think clear messaging, people who work in the system, tell people, you're going through the same thing they are, except you might have access outside that they don't have inside. So I think it's really important to be honest, straightforward, and to answer the questions. One of the problems I keep hearing is that people ask questions and the medical staff has been unwilling to give them answers. So I'm hoping that changed, but that has been a problem. So truth, honesty, and compassion.
Thank you. Na'alehu, this one's for you. Related to your work and your area of work, what aspects of the COVID-19 response would you like to see change in the coming year?
Yeah, the response thing is tricky, right? Because we don't know which of the response techniques actually work really well. We started off with just a sledgehammer, right? It's like either open or close, and there was really that's it. And there was no way that you could actually go with a scalpel and slice off little parts of the community that were problematic in spread. And now we have those tools. We do, because we know who's vaccinated, we know who's not, and we know more about the virus. I think the part that I'm probably most concerned about is just the wait to see before we respond, right? And Delta like snuck up on us, even though we had data in other parts of the country and other parts of the world that were talking about it. And I think the challenge with that is to be not so overbearing that people in the community won't comply because they feel like it's not worth it in terms of what we're asking them to do, but at the same time, not take so long that the case counts spike and then we overburden the whole system.
Yeah.
Great, thank you. Dr. Akiona, you mentioned everyone getting equal amount of effort and support and not making assumptions about the populations we serve. How can we relay that message to our community members and those who work with those who might have those kind of manao?
Yeah, no, I think it's been kind of interesting because I think across the board, it's been trying to encourage people to understand that they all deserve better. Like we all deserve better. The situation of health care across the entire nation has gone down. And so this isn't like it just kind of happened yesterday. It's like kind of the erosion of a lot of our public health situations. So we used to have robust public health nursing, and they steadily kind of got some funding cut, and then you would see certain programs going away. And so this is the effect of generations worth of stuff kind of backsliding. And so I don't look it, but I'm old enough to remember that things were a lot different in my 20s, and now I'm 40, and things are actually in a lot of ways are worse than before. And so it's been trying to encourage people to understand, no matter if you're the bellhop in the front or you're the CEO, we all actually deserve better care. Like it's across the board. And that, if you're able to think about the most vulnerable person, because I have some of my family members that, have been addicted to drugs or have been in prison or have done, I have them in really, we know people in these situations. And you think, how would you like them to be cared for? And, and think about your own parents and just understanding that we all deserve better. And I think once people kind of understand that, it's like, it's coming from a place where we know that it is possible. I can tell you as a healthcare provider, it's possible to be better. We can do this better. But fighting one person it's hard. But I think when people understand that they can ask for better, they can ask their leadership to make better choices. Like ask them why are we cutting certain services? Why are we allowing a certain group of the population to kind of suffer a little bit more? And then actually get answers instead of just kind of roundabout things. That was hard for people to understand. And it's just empowering people to use their voice, I think, and not throw your hands up in the air and be like, what does it matter? And you would think that that's not a health thing, but like better health is better education, and the more educated we are, the better we live. And I think it's very much intrinsically tied with how our quality of life improves if we're better educated, and that's the key to me. I'm sorry. Just help educate as much as possible.
Great, thank you. And I want to shoot this question to all three of you. If you had to pick one, what would be the highlight of your work or the impact this year? If you could share just one of the many. Kat, maybe you want to go first?
Love. It's all about love. And when you love your community, you are going to do everything you possibly can to make sure that everybody is safe and healthy.
Thank you. Doctor, if you want to go second, your highlight.
I think just realizing that my existence is kind of, so my great grandma is still alive. She's 97 years old. And my daughter just turned 11, got her second shot. And that, just how far in a lot of ways we've come forward. And then how, just being able to recognize how much further we have to go, that it's not all done, and just, I think for me, the best part of my day has always been talking to people and just hearing their stories. And I wish I had more places to kind of give it, because people are amazing. Our state has some pretty fascinating people, and that's what keeps us going. I think that's what kept me going for 2 years.
Me too.
Yeah, and I guess for me, it's like a hybrid of those two. Hawaii is a very special place. I think this community has behaved differently than many other communities across the country, and we've seen it in the kind of aloha that that folks show up with. They show up with for healthcare workers. They show up with these vaccine and testing pop-ups. And one quick story that I would share just happened a couple of weeks ago that really punctuated it for me is like, it's just like this idea of access, right? It's like, I've been so to be clear, right? COVID POW isn't running any of these vaccine testing and testing pop-ups. This is like with Tele, if you guys know Tele, and with all of these phenomenal healthcare partners on Oahu. And so we help with some of the collateral with COVID POW, and I personally go out to as many as I can, 2 or 3 a week, just to help out and sometimes document the stories and engage. And what's so interesting to me is that even though you can go and get a shot at a CDS, or that kids are lining up in schools to go and get the shot, that families really see this as a really personal thing. And they don't want to just send their kids to a school and get their shot on their own, and I'll see you at the end of the day. And so there was this family that came through, and it was these 2 young kids who had just become eligible when 5 to 11 opened the other week. They came and they brought the mom and the dad to get their booster shots. They were eligible, and then they brought grandma. And great grandma. So there's just 4 generations that show up to this vaccine pop-up in Kahaluu on my side of the island. And, we took this picture, 91-year-old, just, similar to what Dr. Akiono is talking about, 91-year-old all the way down to the 5-year-old, right? And they came and they did it together, and they came and they showed up, in person because of, I believe, the tie that they have to community. They wanted to stay in community. They wanted to find people who look like them. They wanted to interact in a place that they felt was safe. And that's a really important reminder for all the things and all the ways in which we have to improve the way in which we engage community. We're going to meet them where they are. We have to engage them in a way that's appropriate to them. And we have to be a reflection of them. And so that's really important. And I was just so honored to be there to take that photo with those 4 generations.
Oh, that sounds really beautiful. Yeah, all the way, the whole Mo'okua Hall. You can see the whole family from top to bottom. What beautiful. So we're just kind of rounding up the time for our webinar. I want to thank you all, Dr. Dan Akiona, Kat, and Na'alehu, for being our guests today on our webinar. I want to thank all those on Zoom who have joined us. And lastly, I want to thank our Hi-Fi staff behind the scenes. We will be continuing these monthly trainings in 2022, and we will share details as we get closer to the date. But again, I want to thank you all for joining us today. Looking forward, hoping you all have a good, healthy, and safe holiday weekend. Thank you all for joining.
Mahalo, everybody. Thank you. Aloha.